Tonight we're going to talk about really important information for you with sexual issues, and they're dealing with erection dysfunction, Peyronies disease. So erection dysfunction is basically the inability to achieve an erection when you want it. Well, I think this graphic will tell you something that you need to know. Between the ages of 40 and 70, roughly 50% of the men have erection dysfunction. There's a very significant percentage who really have quite severe problems. Let's talk a little bit about how erections come about. This is the erectile tissue, and this is a cross-section of the penis. These are the nerves, and these are the vessels. But when arousal occurs, you'll notice some things change. These muscle groups are configured differently. When there is an erection expected and sexual arousal to occur, these muscles reconfigure, and they reconfigure like this. Here in the erect state, as you notice, these venous channels are compressed. When the central nervous system starts sending signals and changing the chemistry, now these muscle bands within the erectile body change, and that's when this configuration, this entraps blood within the erectile body, and notice what happens here. The veins get compressed. Viagra, and as we all know, it was the first pill that helped with these kinds of problems. The breakdown of this chemical is impaired by the pill, and therefore the erection state can be maintained. And that's why Viagra and Cialis and the bathtub scenes and all of those things that we know about on television occur. After a period of time, when the chemistry changes, the muscles contract, the blood flows through, and the erection can go away. There's other ways to do this than chemically. There's vacuum devices, there's injection therapy, there's suppositories, and there's penile implants. The subject of Peyronies disease. Peyronies disease is when you get a fibrous plaque. It forms in the erectile body. A gentleman gets erection, you get this curvature, and it's disabling. This is a significant curvature. What I'm going to tell you is about the methods we use to straighten the problem out. The plaque can interfere with the mechanism that entraps blood into the penis. We believe that Peyronies disease is a situation where the immune system has lost identity of the tissues that are within the erectile mechanism. What else can do this? Well, at the time of intercourse, there can be a traumatic event, and there can be a physical injury. This can lead to Peyronies. We have a number of ways to treat it. There's medications that can be injected into the plaque. There's a medication called verapamil. With local anesthesia, you can inject verapamil into the plaques, and in a certain percentage of plaques, things will get better. There are people who believe surgical treatment is really the only way to really deal with severe Peyronies disease. We can do ultrasound studies and identify the plaque. We have a corpora cavernosogram. The plaque, which is right here, does not, I repeat, does not invade the erectile tissue. This is the group where I feel most confident that we're going to get an excellent result. Here is the penis as the patient presents. Here we've made a circumferential incision, pulled the skin back or degloved the penis, and here's where the plaque is. What we do is we identify the plaque, we excise the plaque, and then we place a graft where the fibrous scar tissue has been. One of the graft materials we use is essentially pericardium. This is tutoplast, and that is what I've been talking about. This is a situation when we're done and the patient goes home. Now we have to go through the healing phase, and this is really a program. And from the time we do the surgery, it takes us about 3 months to get through these whole sequence of events. But the net result is that patients who've had significant curvature of the penis with a relatively straight penis, but a lot better and a lot more functional. Let's talk about inflatable penile prosthesis. Patients who have these devices, if they're well chosen, we want to do this on a patient who has a problem that you can't solve with simpler therapy. They do great. They become ministers to tell other people that there is an answer. So this is the prosthetic device, and let me explain to you how it works. This is a reservoir. Everything's inside the body. The reservoir is behind the abdominal wall. There's a pump in the scrotum, and there are cylinders in the erectile tissue. When there is a desire for an erection, you manipulate this portion of the pump. Fluid is pumped from this reservoir into the cylinders. Both cylinders inflate, and they have a very substantial erection, very durable, and very dependable. And then, by manipulating this aspect of the pump, the fluid flows out of the cylinders back into the reservoir, and the penis is soft and feels normal. Very high percentage of patients are very happy and are not at all adverse to telling people that we have excellent treatments if you decide you have a problem and you're focused on wanting to do something about it. How does the prosthesis fit into Peyronie's disease? That the plaque sometimes involves the erectile tissue. Those are difficult cases to treat. I'll excise the plaque. We'll use a graft. We can put those grafts into the defects where we excise the plaque. Now, a significant number of those patients will come back. They'll get things going, but some don't. In those patients, we'll place an inflatable prosthesis. Just placing a prosthesis, because just having a prosthesis and having that prosthesis inflate appropriately can take care of a significant percentage of patients who have the problem of curvature. We've had a plaque, but just by putting a prosthesis in place and using the inflatable character of that prosthesis takes care of the problems. The Knightsbridge Surgery Center, and I'm going to show you some pictures. We do minimally invasive treatment, which by my definition means that people can go home and sleep in their own beds after having a surgical event and not have to be tethered to a hospital and not have to be inconvenienced with being unfamiliar with their surroundings. This is where we bring patients in and check them in. This is the operating room where we do the procedures. We go back to a similar area for recovery. And what I would say to you is you should avail yourself of ambulatory surgery. 70% of the surgery that's done in this country could be done in facilities like this for somewhere between 2/3 and half the cost. The Knightsbridge Surgery Center website, which references all the docs that work here,